This next tip, it came from one of my students, and I have shared it so many times, and students love this. And that is that you can set content as a screensaver. So let's say you're struggling with some type of information. Maybe it's vital signs of a newborn. It may be different Maslow's hierarchy. It could be electrolytes. Whatever topic that you are just struggling on, you can take that content, take a picture of it, and then make it the screensaver on your phone for the week. So you'll have to take off that cute picture of your family or your friend or your great hike that you went on. But it's just all in the, to get you prepared for the NCLEX. So you can make this your screensaver. And that way, again, how many times do you look at your phone, right? Again, standing in that coffee line, standing in the grocery line, maybe standing in a pickup line for your kids or at the side of a soccer field. You can easily review that information and then every few days change it up to something else. So I think that's a really helpful idea. It really helps you, again, study when you just have a few minutes here and there. And here's someone who did it on their iPad. So here they're studying about potassium, and they made this a screensaver on their iPad. So take advantage of all these different tools just to mix it up and do something different. I also really believe in sticky notes. And I always tell students, when you're getting ready for the NCLEX, you need to turn your room, your home, your apartment, your dorm room into an NCLEX prep site. So whoever's living with you is also going to get ready for the NCLEX with you, right? And by this, what I mean is take advantage of your refrigerator. Turn your fridge into a review board for yourself. Pick a topic that, again, maybe you just struggle with it. For whatever reason, it's not staying with you. Make it fun. Turn your refrigerator into a review board. For me, I would do one on maternal health because that would be my weakness. So I would put all kinds of items on my refrigerator about maternal health. And how many times do we go to that refrigerator? Every time I get ready to open it, I have to review this board. Once I've mastered it, I can change it into a different topic. And then this one is probably something that I'm the biggest believer in, and that it's often underutilized, is the idea of practice teaching out loud. So whenever you're getting stuck on content, again, how many times have you read that chapter in your nursing textbook and you close it and then you can't even recall anything you just read? All right. It's not staying with you. And if it's not staying with you there, it's not going to stay with you on test day. So one of the things that I really believe in is that once you read material, I want you to close that book, and then I want you to pretend like you're teaching your next door neighbor. So let's say that your next door neighbor, you read a chapter on diabetes, and now your next door neighbor is asking you to tell them about diabetes. How does it develop? How does insulin work? And what kind of diet should I be on? And then practice teaching them. And when you are doing that out loud, you will realize where you get stuck and what information just isn't clicking with you or staying with you. Then you go back, you review it, you come back, you practice teaching it again. By practice teaching out loud, I think you will find that your retention is really boosted, and that is going to help you on test day. Another idea that one of my students used was that they would record themselves. They had a really long car ride to and from school. And so what they did is when they were studying, again, kind of like that practice teaching out loud, they would record themselves. And then when they were driving to school, they would listen to that recording. And that was an easy way to get in some extra prep time. And I can't say enough about the real need to practice NCLEX-like questions. You can review content and feel like, I got it. But when you see it on an exam question, all of a sudden you might go, I have no idea what to do with that. Let's just say you read a whole section on hypothyroidism. Well, you know what's going to help you the most? Seeing questions that relate to hypothyroidism, because now you're going to be able to see how is that content presented in a question format. And that's where you're going to really start getting ready for the NCLEX exam. I think students like to stay away from test questions because they feel like test questions are judging them, but you need to get over that. Test questions really are a place of growth. They really show you, okay, I have a little bit of a disconnect here on this one subject. I need to go back now and look at that content, come back to this practice question and see how I should have used my critical thinking to get to the credited answer. So I can't say enough. Dive into those practice questions. Do as many practice questions as you can. And that's what I get so excited about with Kaplan is we have so many practice questions for you to work on. And in fact, we even have them in an app that you can practice on the go. So, take one question at a time. Every single question, you're going to learn something from it. Next, I would say I really like students to be intentional with their study. And what may surprise you when I say this is, I don't even just mean be intentional. When you have a study day, I want you to be intentional about what you're going to do. But I also want you to be intentional about taking a day off. All right. Students will email me and they will have been studying and studying. And then all of a sudden they'll say their scores have started to decrease and they get really concerned. I was doing so well. I was working so hard. And you know what? Most of the time I'll say, I want you to take 2 days off. I want you to go to have fun, whatever that is for you, and relax, clear your head, and then come back to studying. And I would say the majority of the time students find that that is what made a difference. They were really experiencing prep exhaustion. They were burning themselves out, right? If you think about a lot of different sports, often right before the big day, before my daughter was a track runner, before they had the meet the next day, the day before was a light practice so that your body had the energy to run well the next day. You need to really do that for yourself as you get ready for the NCLEX. So take breaks from studying.